Hi everyone, my name is Madeline Williams, and my project is focused on how to reduce something called burnout in nurses with the utilization of mindfulness techniques. So the problem at hand that really impacts nurses is something called burnout, which is otherwise known as work-related stress syndrome. Burnout was defined by the German Society of Psychiatry and Psychotherapy, Somatic and Neurology as an exhaustion and overload syndrome, which is a risk condition for altered psychiatric or physical illnesses. Currently, burnout is not considered an independent illness in the eyes of the World Health Organization, such as something like anxiety or the flu or diabetes is. I stated on the previous slide that burnout is known as an exhaustion or overload syndrome. Some of the symptoms of burnout include, as stated, exhaustion, cynicism, and a sense of inefficiency. Now, these particular symptoms can really lead to some dangerous factors. Exhaustion can lead to increased irritability and a lack of sensitivity with patients, and it could also lead to medication and patient identification errors. Cynicism can lead to a decreased sense of trust with our patients and skewed judgment. This is especially concerning because much of the information that a nurse gathers from the patients is by word of mouth. If a nurse is really struggling with burnout, their judgment may be skewed, and they may not believe information that the patient says is really in fact true. A sense of inefficiency can lead to hopelessness and helplessness. This can lead the nurse to believe that it won't get any better and the rest of their nursing career is just burnout. This is remarkably concerning. In addition to the symptoms of exhaustion, cynicism, and a sense of inefficiency, other symptoms include emotional exhaustion, depersonalization, and professional dissatisfaction. Burnout impacts so many different nurses. This overload syndrome is not discriminatory towards any type of nurse, regardless of age, work experience, area of specialty, gender, sex, you name it. Anybody can be impacted. Burnout has been linked to intense workloads and decreased staffing. Now, nurses know that this describes our profession very well. To truly understand the impact that burnout has, I have some statistics. Out of 4,180 nurses in Iran, 36% of those nurses were impacted by burnout. Now, if my math is correct, that's 1,505 nurses that have been impacted by burnout just in this study. Another alarming statistic is that up to 37% of nurses leave the profession due to burnout. Also, just to specify, burnout can impact any single person regardless of job title, but all of the following research is focused on nursing in particular. So, we've established that burnout impacts nurses in large numbers, but how does burnout impact our patients? Burnout has been linked to numerous circumstances, more than one's just listed on the slide, but it has been linked to negative patient outcomes and an increased number of complaints from patients and their families. Some of the negative patient outcomes are things that nurses are extremely involved in, such as prevention of patient falls, infections, and medication errors. These are the interventions that could possibly be prevented by nursing care, but lack thereof due to burnout. Also, it was found that in Canada, Germany, Japan, New Zealand, the United Kingdom, and the United States, burnout led to a decreased quality of care for patients, as evidenced by survey results. So after hearing about what a large impact burnout can have on the individual, you think, well, what can we do? Mindfulness is a technique that has been traced back to the Buddhist tradition and has been found to combat the impact of burnout in nurses. If you've ever heard of mindfulness, it's a type of meditation that's kind of an umbrella for many different techniques. Some of these techniques include breathing, body scan, walking meditation, etc. a lot of mindfulness is really grounding techniques. It puts us to live in the moment. If you think back to the previous slides, one of the symptoms of burnout is depersonalization. So mindfulness forces us to take in our surrounding stimuli and not be stuck in our thoughts. So it really does combat the impact that burnout really has for many, many people. So what research do we have that mindfulness has a psychological impact on the individual? In 2013, a study found that nurses who completed mindfulness exercises every day, 2 times a day, resulted in decreased burnout scores. Also, in a more recent study in 2017, it was found that 5-minute mindfulness sessions decreased depression, stress, and anxiety. So these nurses took 5 minutes out of their day to complete these techniques and really found a difference. And finally, 1 out of 5 people who were absent from work under FMLA or the Family Medical Leave Act were out due to mental health reasons such as burnout. So research has shown us that mindfulness has a psychological impact on the individual, but what else has it shown us? So something interesting that I found in my research is that mindfulness can also have a physiological impact on us. Completing mindfulness techniques could lead to a decrease in cortisol levels and blood pressure. And cortisol is released when we have acute stress episodes. Another study found that after 8 weeks of completing mindfulness exercises, 3 significant changes were found in the brain. These changes include a decrease in the amygdala response to emotional stimuli. The amygdala is involved in our emotional regulation, and this means that it could allow us to look at things more clinically with a greater critical thinking skills rather than emotion. Also, there is an increase in the brain's gray matter density and an increase in the thickness in the insula and prefrontal cortex. Again, this is involved in emotional regulation and functionality. So ultimately, bottom line, mindfulness leads to greater emotional regulation as reflected by the changes in these individual brains as they completed these exercises for a certain amount of time. That allows the nurse's judgment not to be skewed by emotion or burnout, but just by what's in front of her. So, nurses had said that after being a part of a 10-week mindfulness class, that they really felt that they had gained something from it. One nurse said, "I am listening more without rushing to provide an answer or response." I pulled this out because I really think that it's significant, especially for a nurse, because a lot of times we are programmed to say something to a question. If someone asks how we are, you say, "Good, and you?" Sometimes we go to the movies and they say, "Enjoy your movie," and you say, "Thank you, you too," even though, they're not seeing a movie. These are things that are automatic, but what this nurse is saying that mindfulness helped him or her stop being so automatic and started listening to his or her patients in the moment. Another nurse said that I can find meaning and reward in everything that I do. This is also significant because I know that there are days at work when you feel like you really aren't making a difference or an impact. Mindfulness can help us see the impact we are actually having on people every day. Patients also had good things to say about mindfulness. After nurses had completed mindfulness exercises for so many weeks, patient survey scores reflected this positively and increased 32 points overall. So what would the plan be to implement mindfulness into an organization? I would start with a pre-survey to determine the level of burnout and the impact that it is currently having on the nurses. Then I would teach mindfulness techniques either through a seminar during a staff meeting, through educational videos, or informational sheets that I would hand out. I would also have the nurse complete these techniques one time at the beginning of shift for at least 4 weeks. 4 weeks has been the lowest number of weeks I have found to have an impact. Then I would administer a post-survey and determine if the intervention was effective as evidenced by a difference in the scores. Something that I feel is really important is to receive feedback after the intervention is complete. We have to see how the staff felt and how they felt doing it, and if they felt that anything could be changed for the better in the future. So with any intervention, there's going to be barriers, and it's important to identify these barriers so that we can fight against them and reduce the resistance to change. A big resistance to change could be adding another task to these already burnt out nurses to complete. Being burnt out makes you feel so exhausted, trying to add another task seems near impossible. That's why it makes it so important to reinforce the evidence that reflects that mindfulness can really be impactful on these individuals. Also, some people are creatures of habit and they may be stuck doing things a certain way. This is sometimes known as a deep-seated factor, and implementing change is something that these nurses don't really want to do. With these people, it's also important to reinforce how much evidence is backing that mindfulness is important and significant and can change the impact of burnout. And finally, time. Time is so important and valuable that some people may not feel that taking 5 minutes out of their day to meditate or complete these techniques is possible or worth it. It's also possible that they may lose interest in the project. The next slide shows how to reduce these barriers to change. Different steps can be taken to reduce resistance to change. For example, unit-based team of leaders can be created to make sure that nurses are completing the mindfulness techniques and recording that they are doing so. This will reinforce the importance of the intervention and also ensure compliance. I think that it's also really significant to increase communication when you're trying to implement a new intervention. Greater communication can be facilitated at staff meetings and through suggestion boxes on the unit. And of course, you need to have strong leadership. The transformational leadership theory is somewhat of a golden standard for leadership. It was coined in 1973 by a man named Downton. There are 4 main parts to transformational leadership. These are idealized influence, inspirational motivation, intellectual stimulation, and individualized consideration. Idealized influence equates to the leader being a role model and kind of practicing what he or she preaches, such as mindfulness. Inspirational motivation pushes the individual to accomplish his or her goals and the organization's goals. With this intervention, that lines up pretty well because the organization wants to save money and have healthy staff members, and the individual wants to be healthy and stop feeling so burned out. It makes sense that these two would collide with this intervention. Third is intellectual stimulation. This touches on how that automatic response that I had mentioned. Intellectual stimulation allows the nurse to use his or her critical thinking skills every day, which is so significant. And finally, individualized consideration. This portion of transformational leadership really pushes it to be its best kind of leadership theory that there is. It allows the leader to tailor his or her leadership to the staff's needs, which really makes it individualized. So, in conclusion, burnout really is a true problem for nurses and can impact many aspects of the care. Mindfulness is a type of meditation that can fight against the symptoms of burnout, which include exhaustion and depersonalization. In order to implement this kind of change, we have to understand that there is a barrier to any type of change. A resistance to the barriers of change can be fought with strong leadership, a unit-based team, an increase of communication throughout the entire network. And nurses really just give so much of themselves that they lose themselves in their profession. Mindfulness is a technique that can really give the caregiver his or her parts that they lost during burnout. And I really feel that that's so important. And the following are references that were included in my PowerPoint. Thank you so much for listening.